Spinal stenosis is narrowing of the spinal canal. It can occur in any region of the spinal canal. So you can see spinal stenosis occur in the cervical spine, you can see it occur in the thoracic spine, you can see it occur in the lumbar spine. And depending on the region of the spinal canal that it's occurring will determine the symptoms that the patient has. The most common spinal canal stenosis is seen in the lumbar spine. It's kind of the workhorse of the spine, if you will, because it's got the most motion, it receives the most loads and biomechanical forces to it. And so those discs tend to break down more so than other discs in the spine. And with that degeneration or breaking down of the disc, spinal stenosis can occur. And when spinal stenosis occurs, again, that's just the narrowing of the spinal canal. So the disc will bulge. The facet joint's reaction is to develop arthritis. And then arthritis, you can get bone spurs, and that can encroach upon the nerves within the spinal canal. Anything that causes a narrowing of the spinal canal, you have a finite space, and then you start getting arthritis and bone spurs and disc bulges. It starts encroaching on that space within the spinal canal. Well, what lives in the spinal canal are the nerves to your legs and nerves to your bladder and nerves to your bowel. And so as the spinal canal narrows, those nerves get pinched, and those patients will begin to be symptomatic. The classic shopping cart sign is talked about, and that's, where patients, they can't walk any significant distance if the stenosis gets severe enough, and so they'll tend to lean on a shopping cart at the grocery store. Or you may see elderly in your family, moms, dads, grandparents, aunts and uncles. You'll see them not being able to walk but a certain distance, and then they have to sit down, rest their legs, and then get up, and they usually walk that same distance, and then they have to sit back down. They have a difficult time walking down to the mailbox depending on how far from the front door the mailbox is. But those are all symptoms of spinal canal stenosis. You also have pain down the extremities. You'll have numbness and tingling, or paresthesia is what we call, in the lower extremities. You can get weakness in the lower extremities. Patients, if it gets severe enough and it goes on long enough, you'll start getting weakness in your feet, and you'll develop what we call foot drop at times. Sometimes they get weak in their hip. You'll see it when they're trying to go up a flight of stairs. They're just not as quickly able to walk up a flight of stairs. They're using the handrail a lot, that kind of thing. They're not able to stand very long, so the symptoms get worse with walking. The symptoms of spinal canal stenosis get worse with prolonged standing. They'll go to cocktail parties and they'll have to kind of sit down in a chair. They're not able to stand with everybody and kind of have a conversation or anything like that. In younger patients and in older patients, they tend to avoid vacations with their family because they're not able to keep up with them. The treatment of that is, depends again on the severity. So it starts with just identifying the stenosis, and that comes with imaging, CTs and MRIs of the lumbar spine. If it's the cervical spine, then we get MRI, cervical spine, CT. And reviewing those imaging studies and then making a determination of how severe it is and what course of action is most appropriate. And obviously the first thing we try and do is avoid a surgical option initially and treat you conservatively. The main goal is to mitigate or get rid of the symptoms and get you back to an active lifestyle or maintain your activities. Because when you talk about stenosis, especially in the lumbar spine, the patient's activity levels just seem to decline and decline, and you can only allow that to happen for so long because it's hard to get that strength and stamina back in the extremities if it goes on too long and if treatment is delayed. If we can control the symptoms, maintain the activity level with conservative measures, and that is expected based on our review of the imaging studies, then we can start with physical therapy, we can do medication. Sometimes we just ignore it. The patient's active, the pain is not that bad, and they're just not interested in going to physical therapy, and we just acknowledge that it exists and find ways that they can do exercises at home, maybe, that kind of thing, to just maintain their activity level. But typically, stenosis will progress and will require some form of treatment. Like I said, we can start with physical therapy. There are certain exercises that can help to reduce the pain and symptoms of stenosis. We can also utilize epidural steroid injections. I don't actually do those injections myself, but I refer you out to get those injections done. I'm a big believer in injections. I've had thousands of patients get injections, and the reason why I'm a big believer is because I'm a conservative guy. I don't like jumping to surgery, and if there's some small procedure that will give them a lot of relief and maintain their activity levels, obviously I'm going to support that. So thousands of my patients have had epidural steroid injections in efforts to avoid surgery. If surgery is done, it's a decompression. We typically have to go in and physically do a decompression, but a lot of times there's instability of the spine, and that's also contributing to the stenosis. And so sometimes it's just a decompression alone. Sometimes we have to do a fusion in addition to a decompression in order to properly treat the condition and alleviate the stenosis. But after surgery, these patients, we've done so many of these, we know how this ends. People do exceptionally well with surgical treatment for stenosis. People get back to an active lifestyle, they get back to walking, their pain is much reduced, and those are the patients that we see in clinic that kind of, they come in 1 or 2 or 3 times after surgery, and then they just kind of disappear because they get back on with their normal activities. Those patients will typically come into the hospital the day of surgery. They'll have their surgery, and those patients are expected to be walking the day of surgery. I try and encourage patients to set goals and kind of walk laps around the nurse's station the day of surgery and continue that walking the following day. Those patients will stay 1 night in the hospital and they'll go home the following day. So it's just 1 night in the hospital. After we see them for their 2-week appointment for any sutures or checking on the surgery site, we set them up with physical therapy, and then they do approximately 4 weeks of physical therapy. A lot of guys and gals will ask how soon they can get back to golf, and typically I tell them that's usually in 6 weeks we can get them back to the short game and just kind of putting and maybe chipping, and then using a driver and driving off the tees is going to probably be 8 to 10 weeks before they can do that. And even still, it's not full force. They're not hitting a major club, but they're at least on the golf course, and maybe they're walking a little bit and also riding in the cart.